Good morning, can you guys hear me?
Yes, ma'am, we can. We'll be getting started momentarily.
You hear me as well, thank you.
Hey, can you hear me?
Yes, sir. We'll be getting started momentarily, Eric.
Perfect, perfect.
For those individuals who have joined us today, don't worry, we will be getting started promptly at 10 o'clock or a little bit after 10 o'clock. Thank you guys so much for joining us today.
Just so you know, I am experiencing some camera issues right now. I'm working on it. I just wanted to keep you posted about that.
No problem, Tara. Thank you guys for joining us. We will be getting started momentarily. So good morning, and thank you guys for joining us. I am Dr. Earl Nupsius Benjamin, the director of the Louisiana Cancer Research Center's Office of Community Outreach and Engagement, and the senior director at Louisiana Public Health Institute of its Tobacco Prevention and Control Program. We're going to get started, and I believe the facilitator for today's session will be Ms. Mitzi LaSalle. So I'm going to turn it over to her, if that's correct, and so we can go ahead and get this started. Thank you guys so much for joining us today. I hope that you learned a lot and that you also ask as many questions as you feel comfortable asking. So thank you guys for joining us today.
All right, great morning. And welcome to the statewide virtual town hall on vaping, where we are addressing youth vaping in Louisiana. My name is Mitzi LaSalle, and I am the regional manager for the Central Louisiana area with the Louisiana Campaign for Tobacco-Free Living, which is a program of the Louisiana Cancer Research Center and the Louisiana Public Health Institute. Our co-technical facilitators for today is Mr. James Husband and Ms. Jamie Cipran will be controlling the presentation flow and observing the Zoom chat and question and answer sessions. And as Dr. Benjamin Robinson said, we are here to not only share information, but we are here for you to ask as many questions and share your concerns with us. So James is the Health Equity Coordinator, and Jamie is the Senior Manager, Policy and Statewide Education with the Louisiana Campaign for Tobacco-Free Living. We would like to thank each and every one of you for joining us today. And just a few housekeeping notes. Please use the chat for the introductions. Please tell us who you are that you've joined today, your organization, and your city and state. Now, all participants will be muted throughout the presentation and remain on mute. When we get to the question and answer section, if you raise your hand, you then will be given the capability and the permission to speak. And we definitely ask that you share your concerns, your comments, and especially your questions. And we have a wonderful panel that's here that will be able to hopefully answer as many as you can. And closed captioning is available. And don't forget to enter your questions and answers in the Q&A section on Zoom. And looks like we have someone that has raised their hand. If you can put your question or concern in the chat, if it's something that we need to address right now, please let us know. But again, thank you so much for joining us. Now, today we'll go on to our objectives to let you know what we will be. So on the screen now, okay, we can go back to the agenda. Just let folks kind of see that one. I'm sorry about that. So that is our agenda for today. We will let you know what we know, vaping facts and epidemic, what is Louisiana doing, what's next, which is our call to action. And then, of course, we're leaving plenty of time for questions and answers. And then our closing remarks and evaluation. Now let's go on to our objectives for today. During today's town hall, you should be able to describe e-cigarettes and vape products, explain the current trends and the risks associated with using electronic nicotine delivery systems. Apply community insight and feedback in addressing vaping amongst youth in Louisiana. Summarize vape-free strategies implemented in collaboration with and across multiple organizations to reduce vaping in Louisiana. Now I'd like to introduce Dr. Earl Nupsius Benjamin Robinson. He is the director of the Louisiana Campaign for Tobacco-Free Living, TFL, and also the director of the Office of Community Outreach and Engagement, COE, for the Louisiana Cancer Research Center. Dr. Benjamin Robinson, welcome.
Thank you, Mitzi, and thank you for facilitating today's session. And also thank you to our staff who are working in the background to bring this production to fruition today. And so we're so excited to have them be a part of our team to bring this thing, make it happen. But we are also just excited that we have a number of people on today's webinar, and we encourage you guys, again, to not only listen about the information that will be shared with you, but also through when we come to our question and answer, please do not hesitate to ask questions. We want people to leave this conversation today with a better understanding of what the resources are, what is happening inside our state as it relates to youth vaping, and what they can do in relationship to helping to play a part in reducing the impact of vaping inside our state, but also helping to reduce cancer prevalence and also tobacco use. And so, as Mitzi indicated, and as I stated earlier, I am Earl Nuxius Benjamin Robinson, a native of Louisiana. I am from North Louisiana, from a little village called Grambling, Louisiana. And so I am the director of the Office of Community Outreach and Engagement at the Louisiana Cancer Research Center. So I bid you a hello and welcome from our director there, Dr. Joseph Ramos. And the mission of LCRC is to work across institutional boundaries to reduce the impact of cancer across Louisiana and the Gulf region through locally focused, high-impact cancer research, patient care, education, and community outreach and engagement. And all of this is done in alignment with our unique cultural, ethnic, and environmental characteristics. And one of the programs by which we do that is TFL, and I am a director of TFL. And that is a program, TFL is a program at Louisiana Public Health Institute. And the mission of the Louisiana Public Health Institute is to lead, LPHI leads and partners with communities to ensure that everyone has a fair and just opportunities to be healthy and well. And I bring you greetings from our CEO, Shalina Davis, who could not be here today. And so I bring you both greetings from Dr. Joseph Ramos and future Dr. Shalina Davis. As you guys know, or have been told, vaping is an epidemic presently nationally, but also inside Louisiana. We have been seeing since 2019 that vaping rates inside middle schools have tripled and that vaping rates inside high schools have doubled. And so we hear that clarion call. The data is telling us something. The increased number of young people vaping is telling us something. And so that's why we are having these conversations. This is our third town hall meeting. This is our first virtual one, and this is our statewide one, but we started our town halls last year in 2023. The first one was in Monroe, Louisiana. We had another one a month ago in Lake Charles. And so we are ringing the alarm to let people know that there is an issue, but there are some resources that they can lean into inside the state. And we want people to be aware of those resources, utilize those resources, and start having discussions so that we can get a handle on what is happening with vaping. And so again, thank you guys so much for joining today's conversation. I hope that you leave the conversation having learned a lot. And please make sure that you complete the evaluation at the end of today's session. Without further ado, I'm going to turn it back over to Mitzi. Again, welcome, welcome, welcome.
Thank you, Dr. Benjamin Robinson, for that beautiful welcome and ensuring that everyone knows why we are here and what we have been doing throughout the state of Louisiana. Now, to get things started, I want some participation from all of you that are on. I'd like to pose a polling question to gain some insight from you all who have joined us today for the webinar. Do you vape or know someone who vapes? All right, and those answers are coming on in. And as Dr. Benjamin Robinson said, it is an epidemic, and I think our responses are showing us that from everyone that is on today, that pretty much we all, definitely the majority, 84% of us, knows someone who vapes. All right, and these are our results. 84% of us that are on today knows someone who vapes. So this is why we are doing this today, for us to reach those, educate ourselves and educate each other on this epidemic, how it is affecting our community, and what we can do to resolve this issue. Thank you for sharing that poll question, and thank you for your participation. We can end the poll. And now on to the first part of this town hall. We will present what we know regarding vaping facts and data showing the health concerns for our youth. And to get us started here, we've got Eric Weinzettel he is the Director of Advocacy, Louisiana, for the American Lung Association. Eric?
Thank you, Mitzi. Yes, welcome everybody. Thank you for joining us. And I'm just going to present a few brief slides about the vaping impact on lung health. If you're joining this town hall, you're likely already know that vaping is dangerous apart from just nicotine, which we know is incredibly addictive and harmful, especially to the young mind. But there also is propylene glycol, flavorings, and other chemicals, including the carcinogens that known to cause cancer, including formaldehyde. And then most importantly, I'm going to talk about diacetyl, which is a chemical linked to a lung disease called bronchiolitis obliterans, but most commonly known as popcorn lung. So you can go ahead to the next slide. So what we know now. So a lot of the topics and a lot of discussion around vaping you'll see is the idea of harm reduction, or you'll commonly see people who aren't in the public health space say, well, it helps, a multi-year smoker quit. And it's important to keep to the messaging that vaping, e-cigarettes, these are not approved cessation tools. Just because they are different than cigarettes doesn't mean they're safe. We've had decades to prove with longitudinal data that cigarettes are extremely harmful. And while we are in the midst of an epidemic, we are still about reaching that 10-year mark since vaping and e-cigarettes really came into prominence. But there was a report released in 2018 that made clear that using e-cigarettes causes health risks. They can contain and emit, and this is another big topic when it comes to secondhand smoke and secondhand vape. Just because it looks like harmless water vapor doesn't mean that's the only thing that is present in it. There's moderate evidence to show that youth who use e-cigarettes are at an increased risk for cough and wheezing and increase in asthma exacerbations. But the one that's most commonly known is popcorn lung. So this comes from the fact that the chemical diacetyl was present, very popular in microwaved popcorn to give that buttery flavor. And then they found workers in the factories creating these suffered a condition that this lung disease, and it became known as popcorn lung. So it was actually banned in those practices, but we see it present here with vapes and e-cigarettes. Go to the next slide. So that's what we know. We know there is the potential. We know there is moderate evidence for certain levels of immediate reactions, but we know there's potential for long-term reactions. So we expect that once more longitudinal data becomes available, that the true impact of e-cigarette use will become apparent, and it will not be pretty. So thank you all.
Thank you, Eric, for that vital information. Definitely things that we need to know, and we are definitely learning this morning. So poll question number 2. How many vape products? So in the next slide, I want you all to please take a look very closely and then tell me how many vape products do you see? It's always interesting when we take a look at images like this for us to know exactly what it is that we are looking for. Hopefully some parents are on, some educators, youth advocates who deal with kids after school maybe. Got some great participation here. How many vape products do you see? Okay, about 50% of us said all of them are vape products. 24% said 5 of them. All right, let's show the results. Let's show the answer. Okay, as you can see there are 5 products there that are actually vapes. So we need to be very observant in our surroundings of our youth. And of course, this definitely gives us a clue into the absolute fact that our youth are being targeted. Because why else would a juice box be a vape? Thank you so much for that. Okay, and we have all right. So now you know what the vaping products are. We will now be joined by Senior Corporal Thomas Clofus with the Calcasieu Parish Sheriff's Office that will tell us more about those interesting products and their flavors, because he's got a really close relationship with the youth who has educated him on those items. All right, Mr. Clofus, take it away.
Absolutely. First, let me test my sound. Am I sounding okay? Great.
You're good.
Thank y'all for having me this morning. Hey, what everyone is saying is so great, and I really enjoy being on the panel and when we did it in Lake Charles, and I'm so grateful for this opportunity again today. I am in my vehicle. I am not driving. Okay, so I do not have my seatbelts on, but I am not driving. But just for a moment, I just want to share some of the things we're doing to counter this problem that we're having, this epidemic with vaping. Here in Calcasieu Parish, our sheriff's department, we have 9 officers, other than myself, who go to the schools and educate students on a lot of the same things that we're talking about today. Popcorn lung is one of the very things we talk about. And I actually have some doctor's reports and some testing, the actual reports, and I have it in PowerPoint. And I show it to the students of a young lady who vaped for 2 years, who experienced, she had popcorn lung just from vaping for 2 years and couldn't breathe and had to be taken to the hospital. And at the age of 22 years old, she carries around a green oxygen tank with oxygen. So we try to educate the students on the dangers of vaping, and also we educate our parents in the schools. We have parent nights, we have community nights that we do, and vaping seems like the topic that everybody wants to hear about, because as the poll showed earlier, mostly everyone on this Zoom here knows someone who vapes or vape themselves. So it's a very big issue. So education is one of the big things that we try to do. Also, another thing that I've noticed, and we talked about this at the town hall in Lake Charles, when our young people take the lead is when I see the biggest difference. At all my presentations I do in high schools and middle schools, I get with the principal before I start talking, and I ask, hey, if I get a vape, if I get students to turn in a vape, can they have a free pass today? meaning they turn it in, no questions asked. I just take it and I show it to somebody else at another one of my presentations. I just carry it in my bag or in my box or something. And the principals always agree that if someone turns it in, that it is a safe space for them. But what I notice is a lot of times, because I'll stand at the door with a gallon size Ziploc bag, and if I can get one student to drop a vape in that bag and their peers see them to drop a vape, I will get 30 to 40 to drop a vape in the bag. But if you got one student coming up and they look behind them right before they do it, and some of their peers are looking at them in a way like, don't you dare give it up, then no one gives up the vapes. But if a student leads, they begin to follow. Also, one more thing I want to share, and then I'll be done. The like the juice box and the markers and all of these things. Obviously, these companies are targeting our youth. I do have students who share with me when they find something new, because I built those relationships with them, and they understand, hey, we could tell Officer Clovis, and it'll help him in the long run. It'll help him be able to get some information and help keep other kids safe. But there's so many products, and as soon as we figure one out, there's something else that has hit the market. The latest thing that we're experiencing here in some of our schools, our parish has over 60 schools, and the latest thing is the cart pens. They look exactly like ink pens, but they're able to hold a cartridge that can not only hold nicotine but also THC. So, and they're very, very popular right now. I got on a website where they show that you can buy them, and they're actually you can only get them through back order because they are such in high demand. So, yeah, I'm gonna stop right there because I could talk all day, but I'm gonna sign off and listen to y'all.
But thank you so much for sharing. We really appreciate that. And your slides have enlightened us as well. And we'd like to publicly salute you for having those relationships with the youth and going in there and, having that great relationship with those administrators as well to get them to cooperate and allow our kids to be themselves. So thank you. Thank you so much for sharing. All right, our next poll question. Everybody get ready. How many middle schoolers vape? How many high schoolers vape? Tell us your thoughts. Thank everyone for so quickly responding and participating with our poll questions. All right, we've got about 96% participation, which is a good thing. All right, let's see what our answer is for that poll question. So 30% of high schoolers vape and 18% of middle schoolers vape. So that is a great segue into our next section of this town hall. We'll share the 2023 vaping prevalence results in the US and Louisiana. And to share that information, let's welcome Dr. Erica Turner. She's Associate Director of Evaluation for the Louisiana Campaign for Tobacco-Free Living. Dr. Turner, thank you for joining us and sharing.
Good morning, everyone. Thank you for the opportunity to be here this morning. Waiting for Okay, today I'll be sharing the Louisiana Tobacco Survey data. And before I share that data, I will talk about where we get this data from. So what is the Louisiana Tobacco Survey? It is a survey that is administered to gather the quantity and frequency of tobacco product usage, as well as knowledge, perceptions, and attitudes associated with tobacco consumption. This survey is administered to youth in Louisiana every 2 years. So we just finished the report for 2023 and are working on the questionnaire for 2025. And the most recent survey data included 21 middle schools and 13 high schools across the state. And I will share that this work that we do around the youth tobacco survey is a collaborative project with the team at Well Ahead, the tobacco prevention and control team. So I wanted to share that background before I hop into the data. So next slide, please. So as indicated on this particular slide, we see that currently about 30% of high schoolers vape. And this slide shows the data over the last 3 years and for us the opportunity to look at trends in the data. So we see that vape, in 2019, we were at 32%, then it went down in 2021, and now it's back up. And so once we get the 2025 data, we'll again look at those trends. And among middle schoolers, we're seeing a similar trend with the data. So it's actually going back up. So about 18% of middle schoolers currently vape. So I was happy to see that poll there. And I see a lot of people, the responses. So just want to share the facts that we have related to the current prevalence of vaping. Next slide, please. So this slide, I'm sharing just a couple data points from the Youth Tobacco Survey again. So most youth try their first tobacco product at about age 13 or 14. So that's around middle school or so. 3 out of 5 youth do not consider vapes to be a tobacco product. One other data point is vapes are the most popular product among youth, and it surpasses all other tobacco products combined. On the previous slide, I didn't go over all the numbers for the other tobacco products, but vapes usage surpasses all of those products. So really speaking to the magnitude of the problem that we have around vaping. And lastly, when it comes to curiosity as why youth are vaping, curiosity is the most reported reason as to why youth are vaping. And this is similar. This is the same for both middle and high schoolers. And the second most reason why youth are vaping is because of the flavors. So this morning, I just had an opportunity to present just a few data points from the Youth Tobacco Survey, which is it's about 100 questions on that survey. And we do produce a report from that survey, and that report will be shared with attendees. So if you take a look at the report and you have questions, you want to talk more about the data implications, because we don't have the time to do that today, please feel free to reach out to me and we can have that conversation. And again, thank you for the opportunity. If you have any questions, I'll entertain those in the question and answer period. And thank you.
Dr. Turner, thank you so much for that information. And as we possibly have educators tuned in here, it is very important that we encourage them, school systems throughout the state, to definitely participate in this survey and each year when this information is asked, so that we can have this information to share with the community and helps us in developing programming that can best reach and resolve these issues. Thank you so much again, Dr. Turner, for sharing. And now we go on to Dr. Mark Sides. He is the director of thoracic oncology at Tulane University School of Medicine. Dr. Sides, thank you so much for joining us, and we look forward to the information that you are about to share with us. Dr. Sides.
Right. Thank you for having me. As you said, we've got a dramatic rise in vaping among young people, which is most concerning. Do we have slides? Yeah, there we go. Our view of the medical community of cigarettes has changed dramatically from actual physicians advocating smoking in the 40s and 50s. It calms the nerves and actually lowers your blood pressure. We all know that that was actually the reverse. We could even sell cigarettes to our patients in the hospital. That led to about 50% smokers in the 50s through the 60s. Excuse me, with new data showing the deleterious effects of tobacco and specifically smoking anything on the lungs and the rest of the body. That's dropped to around 19%, depending on gender. But we were looking at e-cigarettes initially as a possible alternative or a means to facilitate smoking cessation. And it actually does work quite well. It works better than our nicotine replacement, whether that's gum or patches or even the pharmaceuticals. The trouble is that at what cost? So if we look at next slide, shows the initial studies into some of the deleterious effects. It's not just nicotine alone, as been said in the cartridges that you're actually inhaling. It's the propellants, it's the flavorings, especially. All of this is completely unregulated. The items that are in there, is it what's labeled is in there? Is that actually what's there? Is there any oversight? Most of these products are made with very little quality control and offshore, so that we can't actually determine what's in them. Many of the flavorings are actually volatile chemicals that are known carcinogens. And now we have children inhaling them directly into their lungs. It's not just the vape itself, but when we consider the broader impact of the cartridges, the NiCad batteries, the heavy metals that come along with the manufacturing process, and the disposal of these going into our landfills and then getting into the groundwater and coming into the total population, even if you don't vape. And so all of this leads to potential increase in lung cancer, but also other cancers as well. And then if we look at I'm focusing mostly on reviews and meta-analysis because of the time frame. All of these are compilations of many different studies, and it's more of a consensus opinion. And so if we compare e-cigarettes to cigarettes and the deleterious effects on overall health, the pro-inflammatory microenvironment that we get from anything that's combustible, we know that's going to lead to increased cancers, increased lung remodeling with COPD and so forth. That takes years. And then when we substitute these volatile chemicals with immediate inflammation throughout the lungs, we know that youth have an increase with asthma, with lung congestion, chronic cough just from vaping. And that pro-inflammatory microenvironment likely is going to lead to an increase in specifically lung cancers. But the consensus is that the problems with vape are at least equal to, if not greater than, the problems that we see with cigarette smoking. And so to sum up, with the next slide, some of the problems that we have is the heterogeneity of these different vape products. We can't say vape is, because we don't have one single product that is vape. Is it specifically aerosolized nicotine? And it's not. There's so many different flavorings. It's completely unregulated. The different heavy chemicals and or heavy metals, plus the volatile chemicals, the different propellants, all lead to some sort of pro-inflammatory microenvironment, many of which are known carcinogens. then the time to insult with cigarette smoking, the low-dose screening CTs are indicated for people who have more than a 20-pack smoking history and are over 50 years old. I don't think that is going to be the case with the new types of cancers that we're going to see in the lungs of young people, due specifically to vapes. It's going to be hard to tease out with the use of vapes as an alternative to smoking, because those people who have a long smoking history are already at risk for lung cancers, and switching to vape may increase their risk, but it's going to be difficult to tease that out. What we are going to see is with new users, those never smokers who are using vape, the middle schoolers that are going to be high schoolers, that are going to be young adults by the time that we see these chronic, but in this case, chronic is 5 years versus 25 years, injury to the lung leading to cancers. Then not just the vape itself, but the environmental risks, the manufacturing process, the disposal of these vapes, and as was touched on, secondhand vape. Secondhand smoke does lead to increase in asthma and additional lung problems, but has not been shown directly to contribute to lung cancer. We can't say that about secondhand vape. Those chemicals are still there. They're still aerosolized and likely at a parts per million that are greater than what OSHA would require us to wear safety masks if we were in manufacturing plants. And so I hypothesize that the increased use of vape with these never smokers, especially as young as they are, when the lungs are still maturing, is going to lead to not just an increase in cancer in these younger patients, a different type of cancer. Lung cancer itself is relatively heterogeneous, with small cell versus non-small cell versus adeno versus squamous cell, but we're going to see different types of cancers in the lung, as well as in all probability heme malignancies, as these compounds get into the bloodstream and then damage the hematopoietic stem cells within the bone marrow. So I also postulate that we'll see an increase in heme malignancy among vape users as well. So it's not just lung cancer, but it's cancers overall.
Dr. Sides, thank you so much for this very valuable information. And I think what's one of the most alarming parts of it is that there is still research to be done. There are still things that we just do not know and will not know for quite some time. But we are doing the work to try to find out. So thank you. Thank you so much for sharing with us today.
Sure.
And now we are ready for our poll question number 4. This one is a true or false. Does vaping relieve stress? Tell us your thoughts. All right, looks like 84% of us said that it was false, that vaping does not relieve stress. Now, to give us more insight into that question and that thought process, we will now discuss mental health and vaping. Joining us now is Tasleem Van Houten. She is the Chief Program Officer for the Louisiana Public Health Institute. Tasleem, thank you so much for joining us and for sharing.
Well, greetings all, and thanks, Mitzi. Thank you all for having me, and many thanks to the TFL team for hosting this important event. I've already learned a considerable amount myself. And then it's really wonderful to hear from experts across the state and folks who are seeing the impact of vaping in and out of our communities and schools and then clinical settings. So by way of a background, I'm a public health clinical social worker, and my areas of focus in mental health, substance use, or addictions overall is in tobacco work. So today I'm thrilled to contribute to this important conversation, because often we divorce vaping and tobacco use from the addiction continuum and not understand that tobacco use, nicotine, and vaping is a behavioral health issue. And similar to any other physical or mental health condition, it needs to be prevented, treated, and addressed with both therapeutic interventions as well as this deep, enduring commitment towards preventing another generation, as well as current adult users from facing a deep addiction that will gravely impact their health and their everyday lives moving into the future. So to paint you a high level picture of the intersection of vaping use, and I say behavioral health in this case, that of encompassing mental illness and substance use challenges, individuals with behavioral health conditions account for about 40% of all traditional combustible cigarettes smoked in the United States today by adults. But this also makes them significantly vulnerable group for high e-cigarette use. So I'm going to give you just a quick dabble into the adult and then really focus in on the youth. But studies overall have shown that people living with mental health and substance use conditions like depression or anxiety are about 2 times as likely to have ever tried e-cigarettes, and about 3 times as likely to be current users. We also know that individuals with mental illness or carry a diagnosis often combine e-cigarettes with concurrent use of traditional combustible cigarettes, which makes them even at further heightened risk for nicotine addiction, as well as susceptible to the effects of traditional tobacco. So that's sort of overall, we know it's deeply impacting adult populations. We also know that individuals with mental health conditions are more likely to have ever tried e-cigarettes, be current users of e-cigarettes or vapes, and be susceptible to their use in the future. And we also know that vapes are the most commonly used nicotine delivery device amongst youth and young people. So beyond the popularity, I just want to, talk to you a little bit about the growing evidence around the associations between symptoms of anxiety and depression and e-cigarette use amongst young people. So we know there's higher rates of clinical diagnosis of depression in young people who vape or who have ever vaped as compared to never users. We also know that so much of our national, state, and local conversations around addressing the overwhelming youth mental health crisis we are seeing, particularly post-pandemic, needs to include a really strong behavioral health and public health perspective. And it's interesting to really start thinking about the conversations that we're having around youth mental health crisis in our country need to deeply include addressing vaping as an important intervention in that mental health-based research. So the few last things that I'll leave you with, because much to my surprise, I learned so much and really want to open up the floor to the TFL staff and then Q&A. I think it's really important to note that there's significant new emerging research around the association between e-cigarette use other than just depression and anxiety. And the 2 biggest areas where we're seeing that emerging research in young people is findings that e-cigarette use is significantly associated with higher levels of attention deficit and hyperactivity disorder, or ADHD, and really how we're seeing that manifest at much younger ages within clinical presentation. Not surprising based on this slide you might see around understanding brain development, the adolescent, and of course, the way nicotine might interact with the brain. And then of course, we're also seeing really strong emerging linkages to sleep disorders, such as insomnia, sleep deprivation, and other sleep-based disorders, which deeply impact short and long-term health outcomes, particularly around chronic disease, in addition to leading to premature biological aging. And then I just want to close out with saying there's deep intersections with later use of substances. We know that your rate of co-occurring substance use is much higher when there's e-cigarette use or vaping in adolescence. We know this based on the adult rates, that of an increased rate of co-occurring substance use with alcohol, with marijuana, and then most particularly with opioids. So I know there's probably going to be a number of different questions, but for now, incorporating our understanding of mental health and substance use and a behavioral health continuum into this larger conversation, particularly thinking about mental health prevention for young people, is critically important. And I'll turn it back over to you, Mitzi.
Thank you, Tasleem, so much for sharing. And as a reminder to all of our participants, I know that we are sharing a lot of information, a lot of valuable information. Please use the question and answer section of Zoom to put your questions in there, as we will give time to have those questions answered. And panelists, we want to remind you that as you take a look at the question and answer section, there may be some direct questions that you can go ahead and answer via the question and answer section of Zoom here. And we want to thank all of our presenters who have spoken thus far to let us know what we know at this point about vaping. Now we will inform you of the efforts that are occurring in Louisiana to address vaping through education, community awareness, policy change, and cessation. All right, let's keep you engaged. Poll question number 5. I believe that Louisiana is implementing efforts to end the vaping epidemic. Is this true or false? Share with us your thought. I believe that Louisiana is implementing efforts to end the vaping epidemic. About 73% of our participants have answered so far. And it looks like you all believe that that is true. And that's a good thing, because we definitely at the Louisiana Campaign for Tobacco-Free Living, along with the Louisiana Cancer Research Center and the Louisiana Public Health Institute and many, many other partners throughout the state, are definitely working towards implementing efforts to end this vaping epidemic. So we now, we're going to end this polling question. And what is Louisiana doing? So we want to share with you. We are in your communities throughout the state, meeting one-on-one with individuals, organizations, civic, social, and governmental organizations. So we want to share with you at this point what we are doing here in Louisiana. And joining us now is Jenny Dickherber. She is our Associate Director of TFL Operations and Health Promotions. Jenny, thank you so much for joining us and sharing.
Good morning, and thank you. So what are we doing? We can get right into the slides here. There we go. What are we doing? We've heard a lot of information this morning, and which brought us to this point here with the vaping town hall, this statewide level. We heard a lot. We're not hearing undeniable data as we've shared this morning. We are also hearing from the communities that we work in across the state that vaping was becoming a bigger and bigger concern over the last few years. And so what we decided to do was get organized and think about how we could approach this in a more inclusive way. So we came up with this idea of vaping town halls, and started a series this past program year, starting back in October of 2023, to conduct a few vaping town halls and see what we can share with the community, what we can hear, and organize it and get connected and see if we're on the right track and see what else we need to address. And so we started in Monroe in October. We set up at the at the Monroe School Board building, and we reached about 34 attendants in person and 18 online. It was our first attempt, and we thought it was a great turnout in terms of pulling together both our statewide partners, community members, predominantly from the healthcare field, as well as the education field, and other stakeholders. We put together a subject matter expert panel to really field questions that were already trending from communities that we'd already heard. We'd collected several questions and concerns and fielded those questions to the panelists, as well as took questions from community members who had participated. And what we found out was both eye-opening and reminded us of where we need to sort of focus a little further in. It was fascinating because what we had learned was that, you know, as Taslim had mentioned, mental health was in fact truly a key component that needed to be addressed. We had youth really mentioned that mental health was connected in some way to initiation and prevention. We heard from our school experts and participants in the audience that they're looking for ways to support youth, but maybe in less punitive ways and more effective ways to help prevent and help build awareness of the dangers of vaping and what it can do, like we've heard this morning. We heard that parents need to be involved. That the awareness is not at the same level possibly as we as professionals are aware, and they need to be involved, armed with information and resources. Monroe community also revealed to us that vaping, despite all of the secretive tactics of the marketing giants that we've mentioned earlier, is not so secretive to youth. They're well aware of who's vaping and who's not. And the most common place we have found in this community was bathrooms in the schools was where it was happening, where youth were kind of commiserating, and maybe not so much commiserating, but kind of sharing these approaches, these vaping tools. And so what we found out also was that, you know, more conversation like this was necessary. And so this being our first attempt at doing a vaping town hall of this nature, we got a lot of support that, well, where can we do this by a school near us? Can we do this in a community in another part of Ouachita Parish? Can you bring this to East Carroll? And so what we found is that, in fact, community does want to have this conversation and have it continue to come up with action plans, with a communal step. Everybody wants to do this together. Nobody wants to do this alone. And so that was Monroe. Then we went to Lake Charles, where we did our second vaping town hall this past March. And we our population grew in terms of participation here. We had about a little over 90 participants, almost 40 in person, and about 50 or so online. And the online component, I must add, didn't just span the local area. We got a few people from out of state that were curious and just wanted to know what we were doing. And so again, we presented our state partnerships. We built, just to remind and to introduce who is here in the fight. We presented the vaping facts and trends as we've done this morning. And then we again assembled another panel of experts in healthcare and education and law enforcement. As we had introduced earlier, Officer Clofus was part of that panel. And we found similar feedback, similar themes as we did in Monroe. We found that mental health, once again, is a component that must be addressed. We found that vaping, education, and resources like we had seen in Monroe were also needed to arm parents and family members. We also discovered that local regulation of sales was a big conversation in Lake Charles. We also, I will put the caveat, Officer Clofus was part of that panel, so he did provide a tremendous resource for us to have that conversation with community members and really kind of brainstorm. And so bringing law enforcement into the conversation was absolutely a key, I think, in the overall learning of developing these vaping town halls. We again found out that vaping was not considered to be a secretive pastime of youth, maybe secretive to those of us adults, but not to them. One youth actually expressed that, I think during a dance, or maybe it wasn't the prom, but it was some dance, they had expressed that it's so obvious, as she said, that the group of kids that were vaping were vaping because there's this huge plume of smoke or cloud. I guess it wasn't smoke, but plume above them that was very obvious, and that teens in these spaces know who vapes and know who doesn't vape. And that, once again, bathrooms were another key component. And so really the takeaway so far is that more conversation is needed. We found a swell of support for having more vaping town halls, a more conversation with community. That youth voice absolutely needs to be included in this conversation. We found that involving parents and even other youth supporters, older siblings are key to this conversation, arming them with information and resources. One of the biggest things we discovered is that we shouldn't call it vaping with youth. It's known as NIC. And I tested that out with my own teen, and she definitely confirmed that this is a different conversation when you call it NIC as opposed to vaping. And so we found that vaping with youth is also a shared experience in initiation. And that once again, if you haven't heard me say it before, school bathrooms are a hub of activity when it comes to vaping. Local policies, of course, were also a prevention strategy that that communities felt were needed to eliminate access. And above all else, we did hear resoundingly from both youth and adults that acknowledging and addressing mental health needs of youth is insurmountably important. And so we're going to keep doing this because I think we've heard from the community, it was painfully obvious that we need to keep reaching out and finding out more information. So we're excited to share this, and we hope to share more with you from other communities moving forward in the coming year or so.
Jenny, thank you so much for sharing with us. And I told you all that we would absolutely learn something today. And so I've learned a lot, but I will let this one stick out. And we got to start calling it Nick when we're talking to our youth so that they will be comfortable and we can meet them right where they are. So as we continue our vaping town hall, poll question number 6. How old was the first person that died from vaping in Louisiana? How old was the first person to die from vaping in Louisiana? And your choices are 10 years old, 50 years old, 19 years old, 21 years old, or 30. Thank you all for sharing your thoughts on that. We've got about 82% participating. Come on and chime in and let us know what your thoughts are. All right, do we want to end the poll? Okay, so about 51% of us said age 19, and then the next most popular answer was age 10. Okay, and what is the correct answer? First person in Louisiana to die from vaping has been recorded, and that person was 19 years old. So unfortunate, of course, for that family, but the efforts of town halls like this and the work that we're doing in communities will hopefully prevent another family from going through that painful situation. So next, we will hear about vaping policies in Louisiana, and to share those statewide policies and information with us is Jamie Ciporan, our Senior Manager, Policy and Statewide Coordination for TFL. Jamie, thank you so much for joining us and sharing.
Good morning. Thank you for having me. Just to give you some background, yes, the 19-year-old is from Ponchatoula, Louisiana, was from Ponchatoula, Louisiana. His name was Zach Joseph Cottrell, and he was the first recorded death of the vaping epidemic in Louisiana. And after his death, Dr. Bill Wheat introduced the act in the 2021 regular legislature that will be known as the Zach Joseph Cottrell Act to provide for addressing the use of tobacco products by minors, so his death would not be in vain. So I wanted to open with this to talk about what we see in Louisiana as far as vaping-related policies, and what we are doing locally as well. Next slide. So currently there is a legislative session going on. Last year in 2023, there was a House Bill 635 where there was the vape registry that was implemented. Vape registries are not evidence-based strategies to combat the vaping, but they are being implemented across different areas in the nation with the tobacco industry's support. And so we do have a vape registry now in Louisiana. Currently in this session, HB 621 is working to clear up some of the language of that vape registry that we have available. And so some of those products that are being sold have pre-marketing orders from the FDA, and they can be sold and some cannot be sold. And so there are some efforts to educate about how these registry impact the vape industry and how it is not evidence-based, and that we want to be able to do comprehensive policies that impact vaping. Also, there are Senate Bill 434 and Senate Bill 358. They reference using vapes, the use of vapes at school. And there are issues with these bills because we are working to not want to expel kids or suspend youth from schools. We want to keep them in schools. And so what we can do is educate at a state level, educate at a local level of what those policies are, those model policies, alternatives to punishment. So next slide. Instead of having expulsions and suspensions, we want to be able to provide vape education in schools, offer those cessation resources to schools and to communities. We have a vape-free policy that schools can go by and can guide them in a way that is more helpful in tackling the vape in schools and with our youth. We also promote comprehensive tobacco-free policies and smoke-free policies in municipalities, and this includes vaping, where people are not allowed to vape indoors. They're not impacted by that secondhand smoke. And lastly, one of the evidence-based practices that we are promoting is to remove all the flavors from all tobacco products in all locations. And this includes menthol. And so those flavors that you saw, the juice flavors, we want those all removed, not just from vapes. We want to move from all tobacco. And so these are some of the policies that we are working with in Louisiana to improve the vape epidemic. Thank you.
Thank you, Jamie, for sharing. Very good information to know that we are not only working grassroots in communities, but we are also doing some work with our legislators to make sure that, all Louisianans have an opportunity to live a healthier life. So now on to our education, cessation, and policy resources here in the state of Louisiana, and that will be shared by Terrell Gill. She is the Youth Prevention Manager for Well Ahead Louisiana, which is with the Department of Health Office of Public Health. Terrell, thank you for joining us and sharing.
Thank you, Mitzi, for that introduction. Today, I will provide an overview of youth tobacco prevention resources. The School Vape Free Toolkit was created and distributed with the collaboration of the Louisiana Department of Health and Wellhead, Louisiana, Tobacco-Free Living, and the Louisiana Department of Education. Now, schools play an important role in providing a tobacco-free environment and lifestyle for the next generation. Wellhead, Louisiana, and the Louisiana Campaign for Tobacco-Free Living developed a comprehensive online toolkit for schools to take the lead in responding to the youth vaping epidemic and to take down tobacco for good. The toolkit guides schools in creating a tobacco-free environment that helps prevent students from using tobacco products, including e-cigarettes, and supporting students who need help quitting. Wellhead has identified resources for educators comprised of information for each grade level. The identified resources are designed to aid in implementing tobacco prevention into classroom education, such as lesson plans, activities, presentations, and even intercom announcements designed to be read by students in grade 5th through 12th. Next slide. Unfiltered Facts is Louisiana's youth brand, and the campaign was designed to clear up any confusion about nicotine and to set the record straight about tobacco products, notably vapes. By raising awareness, youth are encouraged to get the facts, learn where to get help, and get involved. Awareness also comes through sharing the facts with friends and classmates to prevent tobacco use and help others quit. Education includes straight facts and unfiltered answers about different nicotine products, including vaping. Next slide. The Live Vape Free youth texting program is free and available for teens ages 13 to 17. The program offers multimedia activities that includes videos, quizzes, self-assessments, flip cards, and podcasts. Youth will also have access to a personal quit coach at any time by texting the word coach. The quit coaches will provide education, tools, and guidance to help youth initiate and sustain a quit attempt. The Adult Advocacy Program is a tool designed to equip parents, guardians, or any adult with expert advice on how to approach teens about vaping or who need quit support. Youth can enroll into the Live Vape Free program by texting Vape Free to 8733732 to enroll to get started. Thank you guys for allowing me to share Wellhead, Louisiana's youth tobacco prevention resources.
Terrell, thank you. And so that everyone will know, all of those resources are free and can be used by anyone in the state. So thank you so much for sharing that information. And now we will talk about the Louisiana Campaign for Tobacco-Free Living's Youth Advisory Board. And our Youth Advisory Board are members that serve as healthy lifestyles community ambassadors and share feedback on TFL programs and activities. Our goal one for the Youth Advisory Board is to build community among youth health leaders. Goal two is to enhance campaigns to prevent tobacco and vaping use among youth. And goal three is to collaborate with leaders at TFL and its partners to ensure that young people's voices, needs, and ideas are integrated into the policies and programs that impact their lives. It's made up of a diverse group of youth that were identified from across Louisiana, representing their region of the state and being a voice for youth in their communities. And of course, we have that Youth Advisory Board, as we said before, that we want to meet our youth exactly where they are. We want to speak to them how they want to be spoken to and share information that they will be able to grasp, understand, and implement where they can be supporters of their peers. And another program that the tobacco-free living that we are doing here at Tobacco-Free Living is our vape-free signage. And so this was at the request of a school in Southwest Louisiana. TFL developed school restroom no vaping signs, 4-inch round decals that contain anti-vaping messages and live vape-free resources are to be placed in school restrooms on mirrors and stalls. By placing the decals where vaping often occurs, as we learned earlier in restrooms, they can serve as a constant reminder to reinforce the messages that vaping is harmful and that there are cessation services available to them. Now, the decals contain a message from one of two categories: bathroom humor and positive affirmations. Messages are intentionally brief and include a QR code linking them to the Next Era Live Vape Free web page and Live Vape Free text number. The U.S. Food and Drug Administration created the bathroom humor headlines as part of their The Real Cost Youth E-Cigarette Prevention campaign. We are conducting this pilot program to get youth's feedback and reactions to this signage. So as we move forward, we will have our Next Era youth. They will be taking videos of their peers to learn their reactions to these vaping bathroom signs, or maybe a TFL representative may visit the school and take some video of a few of the students' reactions to the bathroom vape signs. We will then conduct a survey to have students to give their anonymous reactions to the bathroom no vaping signs, and then conduct a focus group for us to learn and get some honest interactions about the vaping signs. So that is a pilot program that we are conducting here in the state of Louisiana, and specifically we're starting in Southwest Louisiana. And based on the results from those focus groups, may very well move on to the rest of the state. Now, next, we would like to highlight our boots on the ground, which shows community grantees, partners, and organizations who are working in grassroots efforts to address and reduce the use of vape products. We will begin by showing you a spotlight video of our community grantees. And we are getting that video ready to share.
Sound isn't working.
Okay, give us just a moment. We're having some technical difficulties, but we do want to share that video. You guys just kind of let me know if we will be able to get that working. We have the video, we're just working on the sound portion. Give us just a moment, bear with us, please.
Mitzi, we're going to get that link to people so that they can view it. We're going to go ahead and proceed. I want to encourage everyone, when you get that link, to please review the video. As Mitzi indicated, it highlights the boots on the ground in the state that are working to ensure that youth are aware of the vaping issue and are aware of the organizations that are working to increase awareness and access to services that can help young people and being aware about vaping and the resources that are available to help them quit. So thank you. Sorry we can't play the video, guys, but we will be sending that to you. And again, it's called Boots on the Ground. Next slide, please.
Okay, thank you. All right, and we'll share at this point. We did intend to have Officer Clovis back on, but unfortunately he had to step away from the webinar for a situation there in Calcasieu Parish. So as he shared, though, in his previous presentation, with his DARE program, he is definitely one of the individuals in their DARE program there in Calcasieu Parish. That is boots on the ground. And as he explained in his previous portion of his presentation here on the webinar, he very often goes into schools, does his presentation on the harmful effects of vaping, and of course with the cooperation of administrators there, once he shares his information, he can then ask those youth to turn in those vapes, and they will not be penalized at all with the schools. So we will move on to our next presenter, which is a community partner of the Louisiana Tobacco Coalition right here in Central Louisiana. Welcome, Akeisha Singleton, who is the CINLAW Youth Education and Cessation Coordinator for the Rapides Foundation. Akeisha, thank you for joining us and sharing.
Good morning, everyone. And actually, I'm not the coordinator. Dallas Russell, who is our program officer here at the Rapides Foundation, is that coordinator. But I'm filling in for her today. I am the director of evaluation at the Rapides Foundation. Very happy for us to be here and taking part in this important town hall, and to be able to participate in this discussion. The Rapides Foundation is a health foundation. We're located in Alexandria, in Central Louisiana, serving 9 parishes. And our mission is to improve the health status of Central Louisiana. So we fund programs in a variety of areas. We rely very heavily on community partners to help us fulfill our mission. We don't do a lot of direct services. Much of our work is done through the funding of grants, and working specifically with community partners to provide resources that they need to do the work on the ground to help get this effort going. So just a little bit about the prevalence in our community. As I was listening to the state prevalence, it made me think about, how we look in our region. We serve those 9 parishes. Our current adult vaping rate is 37.4%. So very similar to what you heard from the state. And when you look at the youth rate, we do have 12.5% of middle schoolers who report that they are currently vaping. And since we started looking at vaping in schools, we've seen that increase in middle school students with vaping. In comparison, when we look at high school students, they're almost as high as the adult prevalence at 25.4%. And surprisingly, with our high school rate, when we first started measuring this rate in 2015, it was about the same as about 25.7%. And then we saw it increase rapidly by 2019, all the way up to 35.5%, which is where it peaked. And so I am happy to report that we have since seen it decline back down. But again, it's still at startling rates at 25%. And in contrast to the Louisiana rate, despite seeing that decline, we realize that there is still a lot of work to be done to help address this issue in schools and in community. So looking at some of the efforts that we do in our community, through our Healthy Behavior Schools Partnership District grants, we seek to prevent and reduce tobacco use, substance and alcohol abuse, and overweight and obesity prevalence with youth in our community through schools funding directly to school districts. So districts apply for this funding and then receive funding that they direct to the schools that participate in the program. As of this year's grant, we awarded a little over $400,000 to 8 of our school districts. And the school districts that take part in our community have about 106 schools participating in this effort at this time. Over the life of when we've done this school grant with our Healthy Behaviors Initiative, we've seen continued participation by the school districts. At one point, we even had all 9 school districts participating. So the partnership with our schools is very solid. and very beneficial to help us to be able to reach those youth in our community, because that's where they are all day. They're in school. The work plan that we offer to them is pretty much a menu of options that the schools are able to decide that they can use to reach youth around vaping, and some of the other healthy behaviors that are under our Healthy Behaviors Initiative. So you could see we do work with them on healthy eating, active living. We also have youth health advocates, which I want to thank Mitzi. She's been in our participated and partnered with us on several of our youth summits to be able to reach youth and work with those advocates to do work with their peers. We also have a vaping prevention program where the teachers work with the Catch My Breath facilitator training, and they implement all the lessons in class and promote tobacco-free environments. We're doing that in about 69 of those schools. And then, as I mentioned, the Youth Summit is our annual event where we invite all of the schools and districts to participate in a one-day summit where they can come and meet youth who are from other parts of the region, and discuss some of these behaviors and how they can resist peer pressure, how they can figure out some of the ways to take part in cessation efforts if they are already involved in those behaviors. The youth health advocates are a critical part of that because they also help plan the effort for their peers and to help us deliver some of the programming. So as of last year, we had about 56 schools participate in that. Next slide, please. In addition to the school piece, we also fund community programming in the form of a mini grant. This past year, we awarded $25,000 to Catholic Charities of Central Louisiana to work on the vaping effort. The goal of that project was not only to address vaping, but also tobacco use among youth and adults, and via virtual participation in vaping and tobacco cessation services. What we found, I think everyone has found since COVID, that the virtual environment has been just astronomical in helping us to extend reach. As you can imagine, in a largely rural community, travel and distance and being able to get to folks who need the most help can be a major barrier to services. And so the virtual participation has allowed us to extend many of the programs that we do and be able to get more participation from folks as we're trying to deliver services. Through that programming with Catholic Charities, they are funded to have trained facilitators implement American Lung Association's programs in 2 of our parishes, Grant and Rapides. We're funding the NOT Not on Tobacco program, which is a proven teen smoking and vaping cessation program. We also fund INDEPT, which stands for Intervention for Nicotine Dependence, Education, Prevention, Tobacco, and Health. And that program is an alternative to suspension or citation for youth in schools. And that was something I know we just talked about, how critical that is. We're also offering cessation services to adults. So just to highlight some of the partners that Catholic Charities works with, in Grant Parish, they are collaborating with the Grant Parish School Board, which offers the INDEPT program to first-time vaping offenders as opposed to suspension, and also the Grant Parish DA's office, which refers second vape offenders to Catholic Charities, and they facilitate that program. In Rapides Parish, some of the students that are in the FINS, Family and Needs of Services program, have been referred to Catholic Charities by the 9th Judicial Court System for support. So we're very proud to be funding these efforts in our community. And we feel that, knowledge is also critical, and raising awareness is so important. So the foundation has also implemented a strategy to do a multimedia campaign throughout our service area where we encourage individuals to eat better and move more. And we say breathe freely, called the Treat Yourself Sinlaw campaign. So it's been airing now on social media vehicles such as Facebook and Instagram. And we also have a television ad campaign that's running, as well as radio. So we're currently looking at all of these things that we're doing, and we hope that this effort is going to help us to continue to see the progress that we've seen so far. Thank you.
Keisha, thank you so much for the Rapides Foundation being such a vital partner in the central Louisiana area and getting out the message of living vape-free and actually providing the funds and resources for individuals in our communities and their programming. So thank you again for giving us information on what we are doing in our communities across the state. And now, as we move on with our vaping town hall, we now will welcome Renee Roberts for a vape-free campaign. Renee is the outreach director for the Louisiana office of the Attorney General. Renee, thank you for joining us and for sharing.
Well, thank you so much, Mitzi. I apologize. And thank y'all all for the service that y'all are doing on behalf of General Merle. I have learned so much today, and I am so excited to bring back all of this information. A quick little kind of teaser that I'm going to give you is that the Attorney General has basically made anti-vaping a major campaign for this upcoming 4 years. And we are currently working on our campaign on the anti-vaping. We anticipate getting in every school for middle schoolers. Our mission is to prevent the initiation and cessation of e-cigarettes and tobacco use among the middle school students. It was very frightening for us to learn that middle schoolers have access, such great access to vapes, and with the harm that it does, she wants that to be her #1 campaign. And I look forward to partnering with all of you and hopefully utilizing best practices and having you at our different schools throughout the state. We plan on doing a major campaign. There's a lot of it I can't talk about just yet, but we anticipate having an event at the school for one day and allowing all the middle school students to come through and have different stations where they can participate and make it a fun day, not a day where we just go in and talk to them in a gym or a library, but we're more engaged with them. And then we can give our information, and so much information that was given today. I look forward to working with the Colonel in Calcasieu Parish so that we can partner with those DARE programs as well and have participation not only from the Department of Justice, but as well as the sheriff's offices within their parishes and the school boards. And we are really focused on getting that out. We anticipate our pilot programs to start in September. And then once we get a little feedback from it, we will go full throttle for statewide and have our entire team of representatives and teachers and school. And we'd love to also connect with you and Tobacco-Free Living to have y'all partner with us at schools so that we can all stand together and try and prevent these young children from starting this very addictive, very harmful product that is not being regulated today. I do have some information I was received from the federal government that they anticipate going on at a federal level with also another huge anti-vaping tobacco campaign, and they look to have legislation in the upcoming fall at the federal level. So we are also watching legislation that's currently going on over across the street at the Capitol. But please feel free to contact me. I will definitely be reaching out to y'all. And again, thank you for everything you do on behalf of Attorney General Merle.
Renee, thank you so much for joining us and sharing that wonderful information. And we definitely look forward to the partnership, because that's what it's going to take in our communities, definitely partnership. So thank you. All right, what's next? Our call to action. We will now be joined and welcome Chriselle Stipe. She is the senior manager for health promotions with Tobacco-Free Living. Chriselle, thank you for joining us and sharing.
Thank you. And I'll go through this really quick. I know we're at time, but a lot of this information will be available for you all after the webinar. So keep an eye out for that. Call to action real quickly, just things that different communities can do and engage to work towards and put efforts towards reducing vaping. Share the school vape-free toolkit, provide educational events for parents, for youth in the area. Participate in those action days. Take Down Tobacco Day, which is April 1st. It used to be Quick Kick Butts Day. Also World No Tobacco Day, which is May 31st. That's coming very soon. And the Great American Smokeout, which is usually in the fall in November. And just other health-related observances where you could link a vaping as a part of. And, you know, it would be great to participate in those things to get community involved and create more awareness and partner with community schools. Next slide. Here's a list of resources. And again, this will be available to you all, but this is just a quick list of the websites of the resources we spoke of today regarding TFL, and also the Health Department, Noella Head, Louisiana resources where the toolkit is, and also the Vape Free line. Next slide.
Rochelle, thank you so much for sharing those free resources. And as a reminder, all participants of today's webinar, you will receive follow-up information, all of those free resources in about a week or so, or a couple of days, just depending on how quick we can get all of that together. So now it's time for, we are open for questions and answers. Is there anyone, do we have any questions and answers in the Q&A section that can be shared?
So I see a question, someone asking, can questions be asked of the panelists? At present, I believe we have Eric still here, Terrell still here, Chriselle, Tasleen, but I believe Tasleen will have to leave shortly. Dr. Sides is here, Ms. Singleton is here, and Jenny are here. And so if there are questions, please feel free to raise your hands, and you'll be called on. And while we're doing that, I'll just look to see, because Adric has to sign off, I'll look to see if there are specific questions in the chat.
I do not see any in the chat, but we do want to thank everyone for staying with us. I'll ask this question to kind of get us going. What could public health do better to address and reduce youth vaping? What could public health do better to address and reduce youth vaping? Do we have any panelists that can chime in?
I hope you guys don't mind me chiming in on this. And I thank you for the 43 people who are staying with us. I think, you know, continue to engage young people. I think it's something that we heard throughout today's session. And I think that is something that we must continue to do. Like the fact that, you know, I'm calling it vaping, I need to call it NICS. And so it speaks to the point that, you know, we have to continue to engage the population that we are most trying to affect the change with. And so that's a takeaway for me regarding that question, Mitzi. But Mitzi, if you don't mind me asking Dr. Sides a question, because he shared a lot of great information regarding the use of electronic cigarettes and things of that nature. But I just wanted to get a bit of clarity. I know earlier he stated that, their early studies indicated that, and I think many of us know this, that, there were some successes in e-cigarettes helping people to reduce smoking. But overall, I think I'm hearing from him that given what is inside e-cigarettes or vaping products or NICS products, that the good may far outweigh, that the bad may far outweigh the good, given the number of combustibles and particles that are inside these devices. Can you speak a bit more to that, Dr. Sykes? Because I think that's what I heard, but I just want to be sure that that's what I heard.
Yeah, that's exactly correct. Using nicotine vape is better than the nicotine gum, better than the nicotine patch in getting people to quit smoking. But now they're on vape. And with vape, it's the chemicals that are inside of vape, not just the nicotine. And the nicotine is not controlled. How much of a dose are you getting? With the nicotine patch, we can control the amount of nicotine that goes in. With the gum, the patient can control how much nicotine they absorb. With vape, we don't know how much is in, what's the concentration, what's the delivery per, what's the absorption through the lungs and so forth. And then everything else that's in vape. We've seen children that overdose on nicotine with nicotine vape, just because of the high concentrations. Then the volatile chemicals that are in the solutions that they're using to help deliver nicotine is causing inflammation within the lungs. So not just the bronchiolitis obliterans, but a chemical pneumonitis, similar to what we see in petrochemical workers before OSHA. So, and my pulmonology colleagues can speak more to this, but it's detrimental, and it's similar to the BO process, bronchiolitis obliterans, the dissolution of the normal alveolar architecture. All that has to be repaired. In the process of repairing that, we end up with more epithelial cell growth, which leads in the presence of carcinogens. And so that can lead to DNA damage, which leads to lung cancers. But lung cancers are going to be probably shorter term, less of a lag time between insult and development of cancer with these chemicals than with tobacco. But the damage to the lung tissue in the short term from the pneumonitis and the loss of the normal alveolar architecture is actually greater than the risk of lung cancer from cigarettes.
So I have a question for Taz, but before I get to that question for Taz, so I'm hearing, Dr. Sykes, I'm hearing two things. I'm hearing that there are many, and carcinogens are those chemicals that lead to cancer. So the e-cigarettes have a number of carcinogens in them that will likely demonstrate in the future that we are getting to cancer quicker. Is that what I'm hearing?
Yes.
Okay, that's what, because I want to make sure that the people are understanding that. Taz, as a licensed clinical social worker and as a public health practitioner, what is it that parents and guardians and school administrators should really take away from today's conversations? I know we have the resources. We have Chriselle, what is it? Vape-free toolkit? Is that what it's called?
Yes.
Vape-free toolkit. We have
Vape-free schools toolkit.
Thank you, Mitzi. The Vape-free schools toolkit. What is something as a therapist and as a public health, mental health practitioner that you want parents, guardians, and school administrators to take away from today's conversation?
Well, first, thank Thank you so much. And I actually want to just quickly build on what Dr. Seid said with just one key important point, which is that vaping can be seen as a harm reduction tactic, but only when used as a single use, right? So the problem is not necessarily this as an intervention for helping folks transition from commercial combustible tobacco use onto an e-cig or a vape. The problem is that the majority of all evidence shows that people continue to dual use, which means we haven't actually solved the problem. So I think from like the clinical point of view, in a perfect world, it's a great harm reduction tool. But in the lived experience of tobacco users, it continues to be a dual use challenge, with anywhere between 40 to 80% of folks reporting dual use, which just means twice as much. Dr. Benjamin Robinson, when you're talking about what folks, I think, across communities can take away from this, it's that we need to continue to focus on advocating for youth first. And most importantly, realizing that the other folks that potentially are really against this is a business community or emerging vape shops that have only been around for 10 years. So you know, being able to say that if we don't intervene now, if we don't focus on youth and youth outcomes above the commercial interests that we are continuing to see in our state, my children and all of your children will still be working in tobacco control in 60 years. Just it will look and have a different presentation. I think what I'm also taking away from this as a public health practitioner, but also for parents, for law enforcement and other community folks, as well as clinical providers, is this bold action is absolutely necessary and can be based on a prevention assumption that vaping will impact lung health, it will impact our rates of lung cancer in the future, and it will impact, I think, cancer rates overall. And that is not a wild public health prevention assumption to be making based on the data that we're being presented with.
Thank you, Taz. Mitzi, turn it back over to you.
Yes, thank you so much for sharing. And we do have a question that one more question that we do want to get to. And this one is for any of our panelists that can answer this particular question. At the community level, what do you think is the most important thing that can be done to fight this vaping epidemic?
I'll chime in, guys. First of all, I just want to remind everyone to be patient with youth during the conversation. You want to avoid criticism and you want to encourage open dialogue. That's important. And you want to keep the conversation going by making sure that you offer the platforms such as Live Vape Free, that program, because you know, all they need to do is just text vape free to 873373, and they can receive that quick help that they need. As I mentioned earlier, the Adult Advocacy Program is a program it's a tool, is designed to equip parents and guardians with, you know, expert advice, you know, so that they can learn how to approach teens about vaping or who need quick support. School administrators can implement a comprehensive comprehensive vape-free policy, offer education resources, you know, adopt a non-punitive policy, which Ms. Singleton mentioned about the in-depth alternative to suspension alternative. And then also, you know, Wellhead, Louisiana can offer technical assistance for those designed to start these types of efforts.
Thank you so much for sharing. And that is definitely a great way for us to end this. Our youth are the most important. Their thoughts about this is the most important. We must be open and we must keep the conversation going with our in order to meet them right where they are. Okay, go ahead, Chriselle.
Hey, sorry about that. I just wanted to add, as a part of all of this and both questions, what could the public health community do, and also what could our communities do and parents do to address the issue? And that's to involve the youth, like we're doing with our youth advisory board, making sure that we're bringing them in to what we're doing and get their input and feedback on how to best reach the youth across the state and also specifically in their communities, because they may be different ways to reach youth in different communities. So definitely getting the youth involved in addressing that issue that's amongst them.
Absolutely. That peer-to-peer advocacy is most likely what is going to work best as we progress here in the state of Louisiana. Well, we want to thank everyone. Thank you so much for staying on with us. Thank you so much for sharing. Thank you to our panelists, our speakers, the community, our organizational partners for providing this important information and spotlighting all of the efforts that are taking place here in the state of Louisiana for us to address the youth vaping issues. Now, we have several ways for you to let us know what your thoughts are about today's webinar and our presentation. Please complete the evaluation link. You see this QR code that has popped up there on the screen. You can scan that to complete the evaluation and let us know your thoughts so that we may progressively move positively forward from your input. The evaluation link has also been placed in the chat. You can get it there. For all of you who registered today, when we send out that follow-up email, you'll also get that evaluation link then as well. And when you exit today, you will also get that evaluation link. And we ask, please take just a very few minutes to provide us with your feedback because it is very important to us as we move forward in our work. A recording of today's webinar will be available, including the speakers' bios and resources. We want to thank everyone again for participating. Thank you for joining us today, and look for the Louisiana Campaign for Tobacco-Free Living partnering with your community for a healthier Louisiana. Everyone have a great rest of your day.
Bye-bye. Thank you.
Thank you.